When a strange disease was reported in the cattle corridor in the district of Nakaseke, the permanent secretary in the Ministry of Health, Dr. Diana Twine, braced the media for causing hoopla across the country.
There is no cause for alarm. Uganda, we have developed very strong mechanisms to deal with any epidemic.
Her outburst was in regard of a 9-year-old boy who was hospitalized at Kiwoko Hospital, which had been widely reported about in the media.
Let us not jump on excitement for anything that we hear from different people. We are in control, we are in charge. I want to tell you that the Ministry of Health is fully in charge.
Despite her denial, the Ministry of Health has this evening confirmed that the 9-year-old boy tested positive with Congo Crimean Hemorrhagic fever disease, but he is recovering after receiving treatment.
On the 27th of December 2017, results from the Uganda Virus Research Institute tested positive for the crimean-congo hemorrhagic fever and negative for other viral hemorrhagic fevers like Ebola, Marburg, Rift Valley fever, and Sosuga. The patient was maintained on supportive treatment in the isolation unit at Kiwoko Hospital, and I'm glad to report that this patient greatly improved. So, following his improvement and positive response to the treatment that was provided, second sample were collected on the 4th of January 2018 and sent to the Uganda Virus Research Institute to ascertain whether the virus had cleared on supportive treatment. The results showed that this child was no longer infectious for the crimean-congo hemorrhagic fever and was therefore discharged on the 5th.
Sarah Opendi, the State Minister for Health, has however dismissed reports that the 9-year-old girl, Brigdet Nalunkuuma, who died on Thursday this week, succumbed to the same Congo Crimean Hemorrhagic fever disease.
A 9-year-old girl from Buswagiro village, Nakonge parish, Wachiato sub-county, presented with high-grade fever, nausea, nose bleeding and vomiting. She was vomiting blood. She died on arrival at Butalangu Health Center 2. The blood sample was taken to the Uganda Virus Research Institute, and laboratory results received on the 13th of January 2018 were negative for the crimean-congo hemorrhagic fever and other viral hemorrhagic fevers that include Ebola, Marburg, Rift Valley fever, and Sosuga.
Opendi says the Ministry of Health is still investigating what could have caused her death.
So the Ministry of Health is continuing to investigate the possible cause of death of this young girl in collaboration with our partners.
Nalunkuuma's death caused jitters among the locals when she bore symptoms associated with the Congo Crimean Hemorrhagic fever and the manner in which the health workers handled her burial.
Yes, we are aware of the 8 cases, the 8 people that are reported or suspected to have died of the crimean-congo hemorrhagic fever, and none of the 8 cases tested positive for the crimean-congo hemorrhagic fever. So they could have died of something else.
The ministry has, however, implored the public to be vigilant and look out for symptoms associated with the disease.
In humans, the crimean-congo hemorrhagic fever can present with several symptoms that include sudden onset of high-grade fever, muscle aches, neck pains, neck stiffness, backache, headache, sore eyes, vomiting, diarrhea, abdominal pain, and sometimes bleeding from body openings.
The disease is caused by infected ticks through direct tick bites or contact with the blood of an infected animal.
These animals become infected after being bitten by infected ticks, and the virus remains in their bloodstream for about 2 weeks after infection, allowing the tick-animal tick cycle to continue when another tick bites.
Jingo Francis, NTV.